As the holiday season gets going, so too is a new variant, now in at least 57 countries.
Indeed, we may be starting to experience a potential tsunami of infections.
The sheer speed of Omicron's spread is changing the calculus of containment heading into Christmas.
If we continue to double in this rate, then I would expect that without any mitigations, we could have 100,000 or 200,000 cases, or even more by the end of the month, in the case numbers that we see every day.
The UK has reintroduced mandatory face masks in most public venues. And as of next week, vaccine passports will need to be shown at the door. New research shows even with 2 doses of the vaccine, the antibodies created to fend off the virus are up to 40 times less effective against Omicron compared to Delta.
People who've had 2 doses more than 3 months ago are likely to get infection and transmit infection.
But there appears to be a silver lining. Early findings show a 3rd booster shot of the Pfizer vaccine can provide 70 to 75% protection against symptomatic infection. Both the UK and South Korea are now cutting the recommended interval between the 2nd jab and a 3rd booster shot from 6 months down to just 3. Cases are surging in South Africa, the first country to report an outbreak of Omicron. But there are early signs the new variant may provoke milder symptoms.
There is a difference this time around compared to the previous 3 waves. The majority of these patients are not here because of a severe COVID pneumonia.
The WHO has warned Omicron won't be the last variant of concern if vaccines aren't made accessible to all countries.
There is risk that the global supply is again going to revert to high-income countries hoarding vaccines.
And successive waves of this virus are unlikely to be sustainable, with a potential exodus of frontline health workers worldwide.
The feeling that they've run already 2 or 3 or even 4 marathons with each wave of the pandemic. We could be needing to sort of replace half the global nursing workforce over the next few years.
A sobering prediction, given the end of the pandemic is not yet in sight. Randolph Nogle, ABC News.